everyone. Firstly, I would like to thank everyone for giving me this opportunity. Um,
Today we have experts from Ayurveda, Homeopathic, and Modern Medicine. Dr. Monali Revatkar from Modern Medicine, Dr. Manisha Shinde from Homeopath, and Dr. Bhojraj Chaudhary from Ayurveda. All are present here.
Yes, madam.
Yes, ma'am. Good afternoon.
See your names. Yeah, thank you. Miss Ruchika,
Dr. Manisha Shinde.
hello, ma'am.
Hello.
hello. Hello.
Yes, Ruchika. Is there?
Yes. Is the screen visible?
No.
Okay.
May I share your slides?
Yes. It will be great if I'll just try from here for a minute.
No problem. Is it visible?
I cannot see the slides, ma'am.
Yes, these slides are visible now.
Okay. So, Miss Ruchika, please try. It is visible to all. You may explain now.
Ma'am, the slides are not visible to me. Uh,
You may join from another device.
okay. So, firstly, good evening to all the members present here. I, Ruchika Nikam, from first year MSc Nursing, studying in Temi Grant Institute of Nursing Education, want to thank you on behalf of my classmates, for giving us this opportunity to present our case. Now, starting with our presentation on diabetes mellitus, first one is patient description. A 70-year-old female, height 153 centimeter, and who weighs 56 kg, was brought in Ruby Hall Clinic in emergency department by her son on 11th 10/23 at 9 a.m. with the complaints of drowsiness, giddiness, headache, and excessive sweating since one day. Signs were checked, and the patient's blood pressure was 135 by 80 mmHg. The respiration rate was 24 beats per minute. Temperature was 98.5 degree Fahrenheit. Heart rate was 88 beats per minute. SpO2 was 98%. On seeing the symptoms of blood sugar level, that is BSL, was done immediately, and the result showed low blood sugar, where the result was, or the BSL was 43 mg per dl. Patient was first given the line of treatment and shifted to ICU for further medical management. Patient has known case of hypertension and underlying treatment and was undergoing treatment of anti-hypertension. Now, starting with the physical examination of the patient system wise, central first is the central nervous system. The patient was conscious. He was drowsy, though he was little drowsy. The GCS score was 15. Other than that, no other abnormalities were seen. The cardiovascular system had no other abnormalities were found, but S1 S2 sounds were heard. Then the respiratory system, patient was breathless. Other than that, no other abnormalities were found. Gastrointestinal system, no abnormalities were found. Musculoskeletal system, no abnormalities were found in the lower and the upper extremities, but the range of motion was normal. The alimentary system, all four quadrants, bowel sounds were normal. Patient bladder was distant. Integumentary system, the skin was impacted and there was excess of perspiration. Now, if you seeing the symptoms of the patient, there can be different diagnosis or possibilities of different diagnosis. Such we can move towards the next slide. So the different differential diagnoses, if you can see, are: the first one is epilepsy. If you can, the second one is stroke. Third one is COPD. The fourth one is heat stroke. Fifth one is accelerated hypertension, and the last one is myocardial infarction. Now, the patient had done investigation based on the BSLs, which were as follows. The first one is fasting blood sugar, second is postprandial blood fasting, third is HbA1c. And it showed the result that after doing the random BSL, the patient was shifted to ICU based on the above investigations. And after the investigation, the patient was diagnosed with DM, that is diabetes mellitus 2, with severe hypoglycemia with hypertension. Thank you.
Thank you so much, Ruchika, for a very nice presentation. Now, to discuss this case, we have expert from modern medicine, Dr. Monali Revatkar. She is assistant professor, biochemistry from Indira Gandhi Government Medical College, Nagpur. Dr. Monali. Dr. Monali. Dr. Monali. Okay, till then, we have next expert from Ayurveda, Dr. Bhojraj Chaudhary. He is assistant professor and HOD of Rog Nidan एवं विकृति विज्ञान डिपार्टमेंट, सेठ गोविंदजी रावजी आयुर्वेद महाविद्यालय सोलापुर.
Yes, thank you, madam. Ruchika, can I audible?
Yeah, sir, you are audible, but you are not visible.
So due to internet connection, I will
Okay.
start my.
Okay, you may continue.
Yes, thank you. Then the Ruchika Nikam ma'am explained his clinical case presentation very well, and all the points are covered according to her case. There is two diseases as like hypertension and diabetes mellitus type 2, they diagnosed this case. As per Ayurveda, diabetes mellitus is correlated with madhumeha, and madhumeha is a type of prameha. Ayurveda acharyas Charka, Sushruta, Vagbhata, and so many other acharya describe prameha. Prameha means means maximum, meha means mutra pravritti. Ayurveda shows characterized by production of excess amount of urine, that is prabhuta mutrata, and having 20 types of prameha. When these are not treated, is converted into madhumeha, and madhumeha is correlated with diabetes mellitus because of madhumeha. Madhu means sweet and meha means glycosuria. The patient having turbid and polyuria, that is glycosuria, then by the Ayurveda called madhumeha. The best way prevent diabetes mellitus, that is madhumeha, we call this nidan parivarjana pathya pathya sadhutta palana. So due to pathya pathyada, there is no chances to hypoglycemia. And premonitory symptoms, Ayurveda can find early symptoms, that is dearth of the teeth, mouth smelling, feeling burning sensation in the palms and sole, that is paridaha, peripheral neuritis, sickness, thirst, and sweetened taste in mouth. These are the premonitory symptoms. And by the Ayurveda,
So
there
these
are
are
three.
very unique symptoms, na, sir?
Yes, ma'am. Sorry.
Can you please repeat? These are
Premonitory symptoms.
unique symptoms from Ayurveda. So,
The accumulation of dirt on the teeth.
yes, okay.
Uh, Foul smell of mouth, sticky discharge from ear, nose, burning sensation of the palms and soles, sickness of the body, excessive thirst, sweetened taste in the mouth, and sweetness of urine. That is as like a structure of madhu, turbid and sweetened. These are the premonitory symptoms.
Okay.
Huh. Then up in 20 types of prameha, madhumeha is a Vataj type. According to Ayurveda, when Vata prominently increase in the body and Pittaj and Kaphas prameha did not treat permanently, then Vat exaggerated and Madhumeha becomes to start with his premonitory symptoms. There are dushas, med, mans, kled. Kled is the secretions when body becomes their dhatus, and these secretions thrown by urine, that is kleda, in which kleda is present, so urine is turbid. As like anya dusha, vasa, majja, lasika, rasa. From these dushas, there is a load on kidney. So kidney completely not filtered and kleda becomes more and more. Then ati pravrutti becomes there. That is mutrasya kledvana, means maximum clay thrown by the urine. That is ati pravrutti. Madhumeha's patients having excessive hunger because of agni. There is a prominent agni. So these patients having more hunger. So as like there is a become a samprapti, that is pathology. The causes as per the Ayurveda, asya sukam swapna sukam means sedentary lifestyle and excessive sleep, means inactivity or lack of exercise, excessive sleep, excess use of milk or milk product as like curd, Grammadako Panam means newly made food. Uh, Water animals as like a fish, jaggery, sugar. Due to these products, kapha prominently increase and kapha make a samprapti, that is pathology. Hyperglycemic diet, we are called that, and plus lack of exercise, then dosha becomes imbalance in the body as like hyperglycemia plus tridosh imbalance, vata pitta kapha imbalance. Basically, kleda kapha produce more and more by the dushti of pachak pitta and samanvayu. Pachak Pitta and Samanvayu work in the body as like a Agni, means digestive power. Dhatvagni Mandya. Due to that, there is a Dhatvagni Mandya, especially Mandagni. Meda Dhatvagni Mandya. Meda, that is fat, Sthula. Sthula Mehi. Especially Meda Agni Mandya increases and Dusha becomes more Dusha. Accumulation of more carbohydrate and incomplete meda dhatu, that is lipid cholesterol. This becomes kledruddhi more and more, oozing from the body fluid, that is through the urine. And these symptoms are called ati mutrata. And due to clade, due to lipid, that urine becomes cloudy. This is called as prabhuta vila mutrata. Prabhut means excess and avil matlab turbid. This pathology known as madhumeha samprapti. And due to that samprapti, Ayurveda, as per Ayurveda, there are some complications like hyperglycemia. In that case, now Ruchita madam presented, she told the patient having hyperglycemia with hypertension. But when complications made by patients, there is a hyperglycemia, hyperlipidemia, along with Bahu Abadda made by the Ayurveda, means unmetabolized product collected in the body, which are not thrown by the urine. And this complication turns into retinopathy, that is netra patal vikruti, neuropathy, that is peripheral neuritis, that is hastapad daha, nephropathy, rukka vikar, as well as by the management of madhumeha, there are three main management: ahar means diet, vihar means lifestyle, and aushadhi, that is medicines. Ahar told pathya. Patients completely stop that having more carbohydrate in his diet, plus curd or milk product or dairy products, newly make jaggery or other foods as like grains.
Is there role of exercise?
Yes, ma'am. If patient not having exercise, then by the Ayurveda, Asya Sukham terms belongs to him. Asya Sukham means completely rest or without exercise, eating and sitting as like.
How different asan they play important role in controlling diabetes.
Yes, when patients exercise, by the Ayurveda, exercise means sweating on forehead. That is the exercise. And when
Yogasan, any yogasan?
there are various types of yoga told by the Ayurveda, mainly Surya Namaskar.
Right. Any vajrasan, other asan?
Yes, Vajrasan used
How
for
it
digestion.
How they control diabetes?
Actually, he is not a yoga expert
Yoga expert, right?
from Ayurveda
Rohini.
Pathology. Right? So, next, I think, is it all, sir?
Yes,
Are there any limitations to treat patient of diabetes from Ayurveda?
There is a limitation as per patient's criteria. If a patient's having uh, uncontrolled diabetes above 11 or 8 to 11 HbA1c, then there is a limitations because of patients not follow if the patyapatyas or his lifestyle, then there is a limitation. If patients follow all rules and regulation as per patyapatya, exercise and medicine, then there will be more chances to cure. Because
Okay. So preventive part is better in Ayurveda, and
yes,
the rupas and purva rupas are very well explained
yes,
as
yes.
per Ayurveda. Okay. Then to discuss modern aspect of diabetes mellitus, we have Dr. Monali Revatkar. Welcome, ma'am. She is assistant professor from biochemistry department, Indira Gandhi Government Medical College, Nagpur.
Good afternoon, everyone. Am I audible?
Yeah.
Yes.
Okay. So from my point of view, means I am MBBS MD. So I will tell you regarding allopathy point of view. Okay. So we actually type this diabetes into type 1, type 2, nowadays type 3 also. Okay. So type 1 diabetes generally that is actually juvenile diabetes. Okay. That is genetically जो अपन बोलते हैं ना hereditary related. Okay. While type 2 diabetes that is maturity onset, it routinely occurs after 40 years of age. Okay. But whatever is diabetes, what is diabetes? It is hyperglycemia. That is increased blood sugar level. And we categorize diabetes on the basis of blood glucose level. Okay. So fasting blood glucose level, if it is 70 to 100 milligram percent, we called it as normal. And if it is more than 125 milligram percent, we labeled it as diabetes. So what happens to this 100 to 125? That is pre-diabetic patient. I mean, these are what? Borderline diabetes. These are at high risk patient. While post meal means we take blood sugar after 1.5 hours of meal. Okay, that should be up to 150 milligram percent. But if it is more than 200, we labeled it as diabetic patient. So between 150 to 200, we labeled it as pre-diabetic. So now, what is pre-diabetes? That is borderline diabetes that can be controlled. Means whatever madam said, that preventive measures should be taken, okay, in order to prevent taking treatment. Okay, so what happens? What is line of treatment here? Routinely, what is mainly pathology, etiology of diabetes, that is, it is related to, it is totally hormonal, it is metabolic disorder. Diabetes is mainly metabolic disorder. Okay, so what happens here? Am I audible?
Yeah, you are audible.
Insulin play important role. Okay, and this insulin hormone, it mainly decreases blood sugar level, and it is secreted by beta cells of pancreas. You know pancreas, that organ that located behind stomach. Okay, so pancreatic hormone insulin, it mainly controls diabetes. If its level decreases in our body, blood sugar level increases, and we labeled it as diabetes. Okay, so what happens in type 1 diabetes? That's we also called it neonatal diabetes also, or juvenile onset diabetes. Okay, so in newborn babies we found it may be. And third type of diabetes, that is gestational diabetes. Gestational means during ANC period, during pregnancy, routinely such diabetes happens in ANC patient. And whole reason is what? Whatever placental hormone secreted by this intrauterine life. Okay, that placenta hormone actually decreases insulin receptors. These insulin receptors are located on different organs, and insulin action mainly taken place by means of insulin receptors. So what happens? Why diabetes occur? What is genetic cause? Here, number of insulin receptors decreases in such patient, and we called it as insulin resistance. Okay, so insulin resistance is found in this patient. Okay, so we had to give insulin from outside. So line of treatment here will be what? Insulin in juvenile diabetes, because insulin is not secreting properly, or if insulin is secreted, our body is not responding to insulin. Okay, so that is insulin resistance. So naturally, line of treatment will be we have to give injections of insulin to this patient. While what is type 2 diabetes, that is adult onset, maturity onset, what we said, it occurs after 35 years, 40 years of age, and here causes not only this hormonal, here like dietary factors, lifestyle, even obesity. Obesity is one of the big factor of type 2 diabetes, because what happens in obesity, if there is accumulation of fat around belly or abdominal obesity, we called it as, it is very high risk. Because of that, there will be decreased insulin receptors. Okay, so
And
more
what
obesity,
range of BMI?
BMI, that is, it is naturally 20 to 25. Okay, normally it is more than 21, we call this as overweight. Okay, but here how we can control it, we can see control by HbA1c measure. Glycosylated hemoglobin is one of the main factor that can, from that we can see control of any patient. Nowadays we are actually advising fasting blood sugar, post-meal blood sugar, but HbA1c is the main factor. It is giving you idea, that is glycosylated hemoglobin. It is mainly giving you idea that last 3 months of sugar level of that patient. Okay, so if it is up to 5.7, we called it as normal. If it is between 5.7 to 6.4, we label this patient as pre-diabetic, means they have more risk for diabetes. They are pre-diabetic. Okay, they are not diabetic. And if patient have more than 6.4 glycosylated hemoglobin, then we label them as there is poor control. So either that patient must change their lifestyle in sense of like smoking, alcoholic, all these are very risky. Okay, even pancreas, pancreas as it is secreting insulin. Okay, so if pancreatic disorder is also there, like pancreatitis, tumor of pancreas, in that case also insulin will not secrete properly, and in that case patient will suffer from diabetes. Okay, so what is line of treatment here? Prevention, how you can prevent? That lot of exercise you must do, weight loss. Okay, dietary control, like increase fibers in your diet. Even diet, I can suggest some diet which can reduce your blood glucose level, like karela, drumstick, okay, even methi, fenugreek seeds, that all they have role that decreasing blood sugar level. Well, other factors, these are dietary factors. If we want to go then a treatment part, then in case of medications, first we are starting oral as metformin drugs, and then insulin. Insulin is best line of treatment here. Anything want to ask?
Is there any advances in line of treatment and all?
Yes, I don't. First of all, actually, any type of diabetes, we want to control complications. Okay, because complications of diabetes is what? That there are microvascular and macrovascular. Okay, two types. Because vascular complication, you must have heard stroke sometimes happen in that patient. So macrovascular complication can be like stroke, cardiac disease, like this, and microvascular complication can also be there. Like we divide it into three parts, like hyperglycemia, it can cause damage to kidney, retina, brain, and we label this patient as diabetic retinopathy, nephropathy, okay, and neuropathy. So all these things, this microvascular complication, macrovascular complication, that should be treated either by first giving medications like glipizide drugs are there, metformin drugs are there, and long-term diabetes that can be prevented by doing by injecting insulin. These are also different types of insulin available in market. You can see live vaccine, some flex pens nowadays available. Okay, because by syringe needle it is not easy to take for convenient for patient. So nowadays you can see flex pens are available. Okay, that we can take on abdominal part or on whatever part of body where muscle mass is more. Okay, so that is best line of treatment.
Okay. Then what are limitations from modern medicines to treat diabetes?
Limitation means first thing is that we want to avoid complications. Okay, complications, and person should change their lifestyle. That lifestyle, because ultimately some factors are there, like genetic factors are there behind diabetes, that you must have heard, that diabetes run in families. Okay, so we cannot control this, we cannot totally control this diabetes, so there are a lot of limitations, but we can prevent it by changing lifestyle, doing exercise and all that. But still diabetes occurs, then ultimately drugs and these preventive measures and using insulin is the only option. Okay, just to prevent complication. We cannot control this genetic level diabetes, we can prevent only complications. Okay, so there is limitations here.
Okay. Okay, thank you so much, ma'am. Then please stay with us. Then we have expert from homeopath, Dr. Manisha Shinde. She is professor and head of homeopathic practices in Dhanvantari Medical College, Nashik. Dr. Manisha.
Yes, ma'am. The case by Dr. Ruchika, the lady is 70 years old lady. I will not explain about the criteria and pathogenesis, which already explained by Dr. Monica and sir. I will just
Monali, Dr. Monali.
explain about. I will explain about the homeopathic perspective of this case. Most important, we as when we take the case, we need patient visibly also, because we have to see the expression of the patient and physical appearance of the patient to complete the case. And in acute condition, we just consider only the acute symptom, and on that acute symptom base we prescribe medicine, and after that we have to find the constitutional simillimum, which is we called as a homeopathic approach. And only after completing the life history and life story of a patient, which needs at least 1 to 1.5 hours to complete it. And in that history about the life, the childhood of a patient, youth age, then middle age, and now recent condition of the patient. Because we have to take the all symptom for the miasmatic diagnosis. As the diabetes mellitus and hypertension has miasmatic diagnosis of psychosyphilitic miasm. And after miasmatic diagnosis, we have to consider further progress of the disease. And one more important, I need one or two more investigation regarding this case: kidney profile of the patient and ultrasonography of the patient to complete case taking, and the relationship of the patient with heat and cold, physical generals, appetite, thirst, sleep, dreams, stool, urine. Because without these criteria, we can't complete the case. Then important is after completing case, nature of the patient, facial expression, whatever adversities in the life of the patient. For example, any grief, any trauma, near dear and death of somebody, and when support in the life was not there. So these are some vague criteria for the complete case taking. And after asking,
Explain the significance of this case history to treat patient.
yeah, with all this data, we will conclude the proper group of the remedies for the approach of the proper simillimum. After selection of the constitutional simillimum only, we can stop the further complications of the case. And in case of management part, already ma'am and sir both had told about the dietary habit of the patient, but we give importance more for the mental condition of the patient, whether he is in stress or not, whether he is doing exercises, pranayam and all that. And proper diet plan, which will be given by the dietitian if possible, and exercise. Then schedule activity with the patient and mental level of the patient. And also, meanwhile, we have to see the further progress of the disease, and if there are any more systemic complications are there, because we have to block the progress of the disease, and after only studying the systemic complications or any pathological changes if there are. So after studying all these, we have to select the medicines, and one of the most famous mother tincture, Syzygium jambolinum, is mother tincture, which most of the doctors gives during the treatment, but this is only supportive form. The major form is constitutional drug, for example, acid, phos, sulfur, argentum nitricum, acetic acid. Mostly acid group are preferably selected for the diabetic management, and for complications for nephropathy, neuropathy, retinopathy, we use always metal group, for example, aurum med, zincum med, acid group, to prevent these further complications.
Okay, and what are the limitations?
Limitations in cases of gross pathological changes in vital organs. For example, CKD or acute renal failure, and uncontrolled diabetic mellitus, which we have to prevent for
Okay.
further retinopathy and all that.
Okay. Thank you, ma'am. There is one another question for you. What is diet management for diabetes type 1 and 2?
For me, this question.
Yeah.
So we diet management for type 1, it is a totally carbohydrate restricted diet, and exercise more and schedule diet, for example, because insulin secretion happens every time when you eat. So if we follow the scheduled diet, that will be more preferable to control the BSL, increased blood sugar level.
Okay. Thank you. What according
And
to
one
you?
more thing, ma'am, I just want to share.
Yeah.
After giving proper similimum drug of homeopathy, the follow-up, how we can come to the conclusion whether this medicine is proper or not. So there are 2 or 3 more follow-up criteria for the perfect selection of the drug. One, that patient should feel fresh mentally after taking homeopathic drug, and he should be more energetic than previous, and looks of the patient should be happy and satisfied. These are the commonest criteria we follow after giving the medication in next visit. Thank you.
Okay. Thank you so much, ma'am. Same question for Dr. Monali. What about diet
Diet,
suggestions?
yeah, dietary factor play mainly important role, and this is in our hand, because routinely diet can be followed. So first, increase fibers. That is advisable, because we all know fibers means whatever salad, that cucumber, everything, because they increases bowel motility and decreases cholesterol absorption and decreases sugar level also. Apart from that, we can advise them. I already tell you, like methi dane, fenugreek seeds, and then drumstick, karela. Karela, it is proved that it also play important role in decreasing blood sugar level. So
What is
that is,
biochemistry for
yes,
what is role of biochemistry, or what is biochemistry for?
biochemistry routinely, that is insulin is the hormone that is responsible for diabetes. Insulin decreases blood sugar level. And what is mainly pathology here, etiology of diabetes, that is insulin is not secreted properly by pancreas, or even if insulin is secreted, body is not responding to that insulin. That is we called as insulin resistance, means our cells are not giving response to that insulin, if even if it is present. This is due to decreased insulin receptors, that I already tell you, like in obesity. If patients are obese, that whatever fat cells are present, that decreases insulin receptors. Even gestational diabetes, that is in pregnancy, what happens, that fetal placental hormone decreases insulin receptors, and that's why there is increase in blood sugar. And you must have seen that once pregnancy, that pregnant woman delivered baby, that again she becomes normal. Okay, so gestational diabetes and all diabetes, main cause biochemistry point of view is that there is insulin resistance, decreased insulin level, and third point we called also, I already told you, type 1 diabetes, that is juvenile diabetes. Okay, that is happens in small children. Type 2 diabetes, that is maturity onset. There is also type 3 diabetes that is related to pancreas. Okay, if patients suffer from due to lot of intake of alcoholic patient, we have seen that if pancreas is totally damaged, pancreas will not able to secrete these hormones. Okay, so that's why they suffer from hyperglycemia. Okay, so like insulin decreases blood sugar, there are other hormones that increases blood sugar level. Antagonist hormones are there, like thyroid hormone, epinephrine, norepinephrine. So what happens if thyroid hormone increases, like if patients suffer from thyroid disorder, we must have seen 90% patients nowadays suffer from thyroid disease. Okay, so they are suffering from, here is the reason, thyroid hormone increases blood sugar level. Even you must have heard stress induced diabetes, ki tension mein diabetes. So what is that? In stress, epinephrine, norepinephrine, cortisol, these hormones increases, and that are mainly responsible for increasing blood sugar level in our body. So that's why here mainly we in biochemistry point of view, even in biochemistry we are estimating blood sugar level, that is monitoring blood sugar level is important if we want to see whether really patient suffering from diabetes. Okay, so different levels are there, and mainly HbA1c play important role to whether it is controlled or not. And if it is not controlled, insulin hormone must be given. That is the only line of treatment.
Okay. So thank you so much. Any other question? Participants?
Now the type 1 and half type diabetes is also there.
Okay, and what it means?
1.5 diabetes means they said it is not juvenile, even it is not maturity onset. Okay, so it is something between where insulin is there. जैसे 30 to 35 years में भी diabetes हो रहा है आजकल, है ना? तो 30 to 35 years में भी
Diabetes mellitus, yeah. Okay.
yeah.
35 to which age
30
range?
30 years 35 years में भी डायबिटीज हो रहा है, मीन्स एकदम न्यूबॉर्न बेबी में भी नहीं होता है और आफ्टर 40 years भी नहीं. So here causes again that insulin is secreted, but body is not responding to that. So it is 1.5. It is between type 1 and type 2. That is 1.5 diabetes.
Understand.
Thank
you. Thank you so much. I think there are no more questions from participants. We have more 5 minutes. You can ask your question. Miss Ruchika?
Yes, ma'am.
Do you have any query regarding
So far so good. No queries.
Okay. So thank you so much to you and your team for a very nice case presentation. It was very detailed and thorough. And thanks to Dr. Monali Revatkar, Dr. Bhojraj Chaudhary, Dr. Manisha Shinde. Thank you so much. Thanks to audience.
Thank you. Thank you.
Thank you.
Thank you so much, ma'am.
Yeah. There is a feedback link in chat box. Please give us your feedback. You may suggest another topics for next online clinical meetings. Thank you.
Thank you, madam.
Thank
Thank you so much, ma'am.
Thank you.